Well, we're here at HRX in San Diego, and this has been the most amazing day and a half, and we already still have another day and a half to go. And I am so excited. I have my really good friend Len, who is going to tell you a little bit about his journey, and then we're going to talk a little bit more.
Well, thanks very much, Fred. It's great to be here. I've been with Abbott for 6 months as Chief Medical Officer for the Cardiac Rhythm Management Unit. But as you know, I was an electrophysiologist in clinical practice for about 25 years prior to that. I served with you on the board at HRS, and I'm very excited about this new phase in my career. I really enjoyed taking care of patients, but I feel like now I have an opportunity to help direct where the field is going.
Well, and you're going to talk a little bit more about this. Because of that relationship with HRS, Len was really fundamental in helping one of our members, Michael Orloff, get some devices to Ukraine. And I know you're going to talk about that a little bit later. But tell me a little bit about, we're at HRX. This is really just so exciting. Tell me a little bit about sort of, what's happening, with Abbott in this space.
Well, I think the thing that we're most excited about at Abbott right now in the CRM space is our Avera leadless pacemaker platform. Avera leadless pacemaker is designed to improve procedural workflow by allowing mapping prior to device fixation. It's also been designed for chronic retrievability, and we think this offers a lot of flexibility to patients and their physicians. As you know, our field has moved away from the concept of abandoning hardware in the heart when it's no longer functional or no longer needed. And we think combined with its fairly incredible battery life, this chronic retrievability will allow the benefits of leadless pacing to be extended to younger patients than previously.
That's very exciting. As someone who extracts these things, man, let me tell you, having something like this is going to be so much better, and it's an incredible technological advance. Tell me a little bit about Abbott with regards to other issues like flexibility and reach and sort of the things that you're doing.
Well, we understand that each patient has a unique set of needs, and these needs frequently evolve over time. So we're very focused on trying to meet patients, their families, and their caregivers at different places and according to their needs, recognizing that those needs may evolve with time. In addition to standard RF telemetry for many of our devices, some of our newer devices offer Bluetooth connectivity with patient apps for remote follow-up, and these include our newer loop recorders, Confirm and Jot, as well as the Galant ICD. And this app-based Bluetooth connectivity for remote monitoring should permit better compliance with remote monitoring as patients travel. We also have services such as Sync Up that we believe will help set up patients for success when they first receive their devices. But patient care begins with access to patient care. We had a great discussion earlier today on the panel about Tequity, which is the use of new technologies to improve access to and quality of healthcare. But we are especially proud to be able to use a low-tech solution to improve access to healthcare, as you mentioned, in the Ukraine, with a donation of pacemaker and CRM equipment to hospitals in dire need. And we're working with Dr. Orlov and HRS in a second donation, which will include not just CRM equipment, but ablation equipment as well. So it's something that we're very proud of.
Well, that's incredible. I mean, so it's just not a one-off. I mean, this is a real commitment that Abbott has to providing access of this amazing and important technology that we have. And by having that technology, sort of throughout the globe, I mean, that is exciting. And your point about flexibility, so important. I mean, there is no question, thinking about the patient care over his, her, or their lifetime is so important, as opposed to being a one-off. You have the device and you're done. And I think that's really congratulations to Abbott for that.
Well, thank you very much, and thank you and everyone in HRS for putting this terrific program together. It's been said over and over. We've all been to lots of meetings over many years, but this new format is incredibly exciting and engaging, and I think that pretty much everyone I've run into has genuinely said, I've learned more, about digital health in the last day than I've learned in the 10 years previously. One other thing I should say at Abbott that we're very excited and committed to is the whole concept of digital health. And just a few weeks ago, we created a new digital health division that will span all of the cardiology units, as well as diabetes care and neuromodulation. So it's something that we think is very, very important for the future of patient care.
Absolutely. I mean, so much of taking care of patients really is communication, right? And digital allows us this incredible platform, but we have to be really intentional about it to ensure the equity, the fact that we allow this digital access to go throughout the globe to all people.
Right.
So with that, I just want to thank you, Len, and thank all of you who are out there, and to come to HRX in Seattle next year.